Hello, I'm Connie Woods. I'm the Administrative Director of the Laboratory at Marion General Hospital. I'll be talking today about Turnkey Autoverification. First, I'm going to introduce you to my hospital, my team, giving you an overview of who we are, the goals that we set for ourselves, the approach and solutions we use to reach these goals, as well as the outcome and results, and talk a little bit about where we're going from here. Marion General Hospital is located in Marion, Indiana. We are a 99-bed independent hospital. 99 beds really doesn't tell the story of how busy we are, though. We do over 1 million chemistry tests annually. We also see over 43,000 emergency department visits. We have a very busy oncology department, as well as employ 56 nurse practitioners and physicians. So as you can see, we have a really busy outreach department. We are accredited by HFAP for the hospital. Our 3 laboratories are accredited by CAP. We also have Commission on Cancer accreditation, as well as chest pain accreditation. Our IT department has also earned the most wired status for 7 years. This is our team. Dr. Ricks is our medical director and pathologist. As you can see, I'm the administrative director. Matthew Wilson is our core lab manager, and Lori Falk, she's our laboratory scientist, who was the worker bee on this project. Here's where we started in our chemistry department. We're very segregated. We had 4 analyzers, and from 2 different companies. The challenges that we faced, we had manual processes, we had approaching staff turnovers. For example, we had an aging population, and as you all probably know, there is not a lot of people coming into the medical laboratory field. And all of this caused stress on our workforce. This contributed to higher costs, opportunities for error, and unmet turnaround times. So our goals, we wanted to improve workflow, increase lab efficiency, reduced worked hours per billable test, and modernize our processes. Our solutions. Again, here's where we started with 4 analyzers. We selected 2 Vitros 5600 platforms. In addition, we knew that changing to the integrated platform was only the first solution. We also needed to implement auto-verification. We selected Data Innovation's Instrument Manager software program. Their preset rules was a very good fit for us. It meant that we could implement this program with a lab scientist with no IT background. So we were able to do this very quickly and efficiently. We found that the Vitros 5600 with Data Innovations was the right fit for our laboratory. The Vitros 5600 enhances auto-verification by providing automated indice testing for every sample run on the analyzer, including both chemistry and immunoassay. The main test interference include hemolysis, icterus, turbidity, and viscosity, and each of these can cause analytical laboratory errors, potentially leading to the release of incorrect results. Erroneous results could be missed if labs fail to perform indices or inaccurately grade them. Literature shows that sample interference represents about 7 to 13% of laboratory testing errors. For patient safety, erroneous results are blocked from being reported by automatic flagging of results with significant interferences from sample indices checks on Vitros analyzers. This prevents results from proceeding to auto-verification through Data Innovations. This white paper by Wendy Sprague provides additional material documenting the value of sample indices assessment relative to reporting accurate patient results. Pictured at the bottom of the page are icons representing several Vitros enabling technologies. The far left image represents the use of disposable sample tips to prevent sample carryover that can be seen with probe-based analyzers. The middle icon represents Vitros microsensor technology, which evaluates samples for serum indice interferences. And the right-hand icon represents IntelliJect technology, which is exclusive to Ortho Clinical Diagnostics. It monitors, verifies, and documents diagnostic checks throughout the testing process. Using analyzers with this comprehensive complement of safety technologies gives us the confidence that Vitros 5600 analyzers are representing accurate information to Data Innovation's middleware for verification and reporting. Autoverification outcomes are as follows. We were able to improve several metrics. For example, our turnaround time on troponin results from our manual process went from 35 minutes to 30 minutes in our new process. Our chem panel turnaround time went from 27 minutes to 22 minutes. We also increased auto verification from about 10% to 90%. We brought in 2 send-out tests, HIV and vitamin D, to improve our capacity for a savings of $36,000 annually. We also consolidated 2 serology kit tests, rubella and rheumatoid factor, onto the analyzer. And our worked hours per billable test was reduced from 0.1912 to 0.1578. I think it's also important to note that within 18 months, we were able to get a return on our investment just from the 2 send-out tests. I'm very happy to say we did reach our goals. We improved workflow and increased efficiency in the lab with a 15% reduction in turnaround time and an 80% increase in auto verification. We also reduced worked hours per billable test by 17% and modernized our processes. This was highlighted in a customer success story with Orthoclinical Diagnostics and Data Innovations. Although we've completed our journey on auto verification in our core lab, we are looking forward to the next phase of line automation. We are expecting great success with that as well. Thank you for joining me today on our journey through auto verification.